Most people believe a heart attack will announce itself. Chest pain spreading down the arm, a sudden collapse, a dramatic moment that leaves no doubt about what is happening. That is the version we have all been taught to expect. But after 60, the most dangerous cardiac events are often nothing like that. They are quiet. They build slowly. They happen in the dark, while you are asleep. No warning, no time to react, no second chance. And what surprises my patients the most, what truly unsettles them when they are finally sitting in recovery, is this. Those events were very often set in motion by something completely ordinary, something they did the night before. My name is Luisa Hart. I am a cardiac surgeon. For over 20 years, I have operated on hearts, repaired arteries, and watched the same patterns repeat themselves in patient after patient. Patterns that are preventable. Patterns that most people have never been told about. Tonight, I am going to walk you through 5 of those patterns. 5 habits that quietly increase your risk while you sleep, and how to fix them in a way that fits into a normal life. But first, you need to understand something fundamental. Your heart does not rest when you sleep. It changes gears. In a healthy body, nighttime is when your cardiovascular system enters a kind of maintenance mode. Blood pressure drops, heart rate slows, blood vessels relax. The body repairs the inner lining of arteries and clears inflammatory debris. It is one of the most important recovery processes your body performs. But after 60, this system becomes less reliable. Blood vessels stiffen, hormonal signals weaken. The mechanisms that once protected you at night do not respond as precisely as they used to. And most importantly, the margin for error becomes smaller. During the day, your body has backup systems. It can adjust, compensate, recover. At night, many of those systems are reduced. Your body is operating with fewer safeguards. That is why the hours between midnight and early morning carry the highest risk for heart attacks and strokes. Not the busy hours of the day, the quiet ones. And what happens during those hours is heavily influenced by what you did before you went to bed. Let's start with the first habit. What time did you eat dinner last night? For many people over 60, the answer is late. 8, 9, sometimes even later. A full meal followed by a short period of rest, then bed. It feels normal. It has often been a lifelong routine. But from a cardiovascular standpoint, it places significant stress on your heart. When you eat a large meal, your body redirects blood to your digestive system. Your heart has to pump harder to meet that demand. Blood pressure rises. Fat levels in the bloodstream increase. This is a normal response. But when it happens close to bedtime, it creates a conflict. Your body is trying to wind down for sleep, but your heart is being asked to stay active and engaged in digestion. Instead of entering recovery mode, it stays in a state of effort. In someone with aging blood vessels, stiffer, narrower, less flexible, that added strain can have real consequences. Studies consistently show that eating within 2 to 3 hours of sleep is associated with higher nighttime blood pressure and increased cardiovascular risk. The solution is simple but powerful. Finish your main meal by 6 or 7 in the evening. If you need something later, keep it light, easy to digest, small in portion. Give your heart time to settle before sleep. Now the second habit, one of the most overlooked, medication timing. If you take blood pressure medication, when you take it matters far more than most people realize. Blood pressure follows a daily rhythm. It rises during the day and is supposed to fall at night. That drop is protective. But many people over 60 do not experience it. Some have blood pressure that stays elevated throughout the night. Others experience surges in the early morning hours. This condition is called nocturnal hypertension, and most people who have it do not know. At night, your arteries are relaxed. They are not braced the way they are during the day. So when pressure spikes during sleep, it places greater stress on the vessel walls. This increases the risk of plaque rupture and clot formation. If your medication is taken only in the morning, its effect may wear off by the time you reach the most vulnerable hours of the night. This leaves you unprotected when you need it most. The solution is not to change anything on your own. It is to have a very specific conversation with your doctor. Ask about timing. Ask whether evening dosing might be more effective for you. This is a short conversation, but it can have a meaningful impact on your risk. Now let's talk about something many people dismiss: snoring. Most people think of it as an annoyance. I think of it as a warning sign. Snoring can be an indicator of sleep apnea, a condition where breathing repeatedly stops during sleep. Each time breathing stops, oxygen levels drop. The body reacts as if it is under stress. Adrenaline is released, heart rate increases, blood pressure spikes. This can happen dozens of times per hour. Over time, this repeated stress causes significant strain on the cardiovascular system. Sleep apnea is strongly associated with heart attacks, strokes, and irregular heart rhythms. And the most concerning part is that the person experiencing it is usually unaware. They are asleep. The signs can be subtle: loud snoring, waking up tired, morning headaches, dry mouth, feeling like you did not truly rest. If this sounds familiar, it is worth getting evaluated. Treatment, often with a CPAP device, can significantly reduce these risks. It may take time to adjust, but the benefits are real and measurable. Now the fourth habit, hydration. Many people intentionally drink less in the evening to avoid waking up during the night. It seems logical. But going to bed dehydrated creates a different risk. When your body lacks fluids, your blood becomes thicker. It flows more slowly. For a younger person, this is usually manageable. For someone over 60, with less flexible blood vessels and possible plaque buildup, it becomes more significant. At night, circulation already slows. Combine that with thicker blood, and the conditions for clot formation increase. This is one reason why serious cardiovascular events often occur in the early morning. The fix is simple. Drink a glass of water before bed, not excessive, just enough to maintain proper hydration. A small step with meaningful impact. Finally, something most people never consider: the temperature of your bedroom. If the room is too warm, your body works to release heat. Heart rate stays slightly elevated, fluid loss increases, sleep quality declines. If the room is too cold, blood vessels constrict, blood pressure rises. Both extremes place unnecessary stress on your cardiovascular system. The optimal range is between 18 and 22 degrees Celsius. Within this range, your body can maintain balance. Your heart can truly rest. Now, when you look at these habits together, something important becomes clear. This is not a list of restrictions. It is a simple routine: a heart-safe evening, dinner earlier, proper medication timing, awareness of sleep quality, adequate hydration, a balanced sleep environment. Small adjustments, but consistent ones. I have spent years in operating rooms, often in the middle of the night, repairing damage that could have been prevented. I have seen firsthand how ordinary habits can lead to extraordinary consequences, and I have spoken with families who had no warning. In many cases, the contributing factors were not rare or unusual. They were common. A late meal, poor hydration, untreated sleep apnea, suboptimal medication timing. These are patterns, and patterns can be changed. So here is a clear summary. Finish your main meal earlier in the evening. Talk to your doctor about when you take your medication. Pay attention to signs of sleep apnea. Stay hydrated. Keep your bedroom in a comfortable, balanced temperature range. 5 habits. 5 simple adjustments. The question is not whether they make a difference. The evidence shows they do. The question is whether you will act on them. Because the most important decisions for your heart are often the quiet ones, the ones you make at the end of the day. Take care of your heart. It has been working for you every moment of your life. Give it the support it needs, starting tonight.